Happy to see everybody here for the fourth webinar in our series, our health literacy webinar series. This webinar is called Safe, Seen, Supported, Creating Spaces of Belonging in Your Organization. And we have lots of guests today to speak on our panel. And I'm so excited to get started. So let's actually real quick, you can see there's a QR code on the first slide there. There's also a small web address. It's a bit.ly web address. So you can either use your phone to get the QR code, or you can type that web address into your web browser, and that'll take you to our resource page, which has tons of links. It has all the different resources that we have sent out in prior webinars. It has resources we're going to talk about today. Lots of things are there. And don't worry if you don't have time to grab it now. We will show it again a few times throughout this session. All right, next slide, please, Nancy. So this is our agenda. There again is that QR code and the short web address if you guys want to get the resource page open. We are going to start with a bit of a talk from one of our guest lecturers about safe spaces. We'll define and review safe spaces. We'll look at how to create safety in your organization. And then we're going to have an awesome panel discussion. And we're going to be recording this session. So we ask that you stay off camera and stay muted for this part of the webinar. And then as usual, after the panel discussion, we will close out. Then we will turn off the recording for a Q&A. So please save your questions until that time and stay after the end of the webinar if you'd like to talk. Next slide, please. All right, these are our goals for today. Define what safe spaces are and why it's important to create them within your organization. Identify ways to build a safe space. We'll hear from our panelists about how they've created and utilized safe spaces, and then we'll reflect on how your organization has utilized safe space practices. Next slide, please. For anybody who's joining us for the first time, I am Dr. Darcy Moeller. I am a medical officer at Cook County Department of Public Health, and I lead our health literacy initiative. Next slide. As usual, we're going to start off with just some very quick reminders about our health literacy initiative as a whole to make sure that we're all on the same page. Next slide. And the definition of health literacy that we use is personal health literacy is the degree to which individuals have the ability to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. Our health literacy initiative is really focused, though, on organizational change, which is based on the principles of organizational health literacy, which is the degree to which organizations equitably enable individuals to find, understand, and use information and services to inform health-related decisions and actions for themselves and others. So it's really what we do as organizations to support people. Next slide. Be sure to check out our toolkit, Advancing Organizational Health Literacy, and so much more on our web hub at healthliteratecookcounty.org. Next slide. And on the web hub, you're also going to find recordings of our past 3 webinars, as well as short videos and tools that we release with every single webinar. We have links to everything easily accessible in that resource document for the session. If you missed the QR code, we will show it later in the presentation again. And with that, next slide. I'm going to pass it to my colleague from Literacy Works, Tiara Whitlock.
Good morning, everyone. My name, again, is Tiara Whitlock. I have been working with Literacy Works for about 2.5 years in their Clear Language Lab as a program manager. We help to promote clear language and its benefits. I have a background working all over Chicago with different communities, especially with youth and their families. We can go to the next slide. As we're getting started, we're going to take a look at the importance of safe spaces. And so in order to do that, let's define it. On the next slide, you'll see that a safe space is an environment where people feel emotionally and physically safe and free from judgment, discrimination, or harm. Creating a safe space is not just for your clientele or those who come to your organization for your services. A truly safe space is for clients, volunteers, staff, or anyone who comes across your doors or interacts with your organization. We can go to the next slide. To help get a better idea of this, I like us to self-reflect about times maybe when you felt frustrated, misunderstood, or dismissed when interacting with an organization. I have an example of former dentist, I emphasize former, that I used to go to. Every time I went, they would have critiques of how I was taking care of my teeth, but it was always given as the dentist had my mouth open and had the tools, and they'd be asking me questions, and it was just like, how am I supposed to answer? And it was just a feeling I felt every time I went. And so they are now my former dentist because I just felt very awkward and kind of condescended on whenever I went to their office. And you can contrast your self reflection with a time where you felt supported, happy, and valued by organizations that you've interacted with. An example for me is my daughter's pediatrician. She had a skin condition as an infant, and I was going into the doctor, I feel like every couple of weeks because it was not going away, and I kept getting dismissed. They kept saying it was eczema. But when I went to her current pediatrician, it was like she actually listened to me and realized what was going on and actually took the steps to investigate what was going on. And it wasn't eczema, it was something else. And because of her, we were able to get the care that we needed. So because I felt heard and valued, I still drive across the city, even though I moved, to take my daughter to that pediatrician because I feel like she truly cares for my daughter's health and well-being. We can go to the next slide. So why is there a need for safety? Why is it important for organizations to be safe spaces? First of all, it's the right thing to do. It's right to treat people as people, to respect who they are, what they've experienced, and to treat them with care and respect. Creating safe spaces also helps to actually serve those who benefit from your services. When people come to your organization, they shouldn't have any barriers to getting what you provide. When you have already addressed potential barriers, be they physical, mental, or emotional, it helps people to have a richer experience and create a deeper connection to your organization. It also helps to get the most out of those that you work with and work for your organization, your staff, your volunteers, your donors. They need safety as well. Creating a community around a culture of safety and support will help your staff to connect with your organization's mission and the work that they're doing more effectively. They'll be able to show that same safety, support, and value that they're feeling with those they interact with on behalf of your organization. You can go to the next slide for some things to consider when making sure that your organization is a safe space. As I said earlier, you want to make sure the safety is not just for those that you serve, but also for those working for your organization. You don't want to have your staff making efforts for others and they feel like their needs are being ignored. You should also consider all aspects of a person, not just their physical safety, but also emotional and psychological safety as well. At any given time, people are dealing with different things, and it's important to take all aspects of safety into account, not just one or two areas. And then you should also consider the power dynamics at play when you're creating safe spaces. When people come to you, especially if you're in a position of expertise or authority on something, there's a type of care in your approach that can help people feel safe and supported without feeling talked down to. Like in my example of my dentist, I was coming to the expert for my teeth, and maybe I wasn't taking great care of my teeth, but with my mouth open as they are working on it was not the best time to be informing me, I feel, and asking me questions about what I've been doing. And I feel like sometimes even the word choice could have been better. We can go to the next slide. Creating safe spaces also helps you to build authentic relationships. Thinking about your staff and the people you work with, if they feel seen, safe, and supported, they're more likely to want to do well in the work that they do. There's more of a connection to the organization when there's a feeling that the organization truly cares about them and their well being. And the same goes with those who receive those services. People can more easily engage with, use, and even recommend your services if they feel like there is genuine care and support for them. Next slide. A large part of your considerations in creating a safe space um, should include trauma-informed practices. Trauma is a distressing event. It's defined as a distressing event or events that may cause people to respond that may cause a response with lasting impacts. It's common and varied, and it can't be defined for someone else. But trauma affects how we interact with the world around us, and there are ways that we can make our spaces safe and welcoming. So on the next slide, we have some examples of what this looks like in action. So safety can be just having a private space to discuss sensitive issues in your building. Trustworthiness and transparency could be shown in being upfront about cost of services and not surprising people with extra additional surprise fees as they're checking out. Peer support can be ways for your staff to support each other and share their experiences and knowledge with each other. Collaboration and mutuality could come from having community input on services and programs you provide. Empowerment and choice can come from having various ways people can get answers to their questions. Maybe someone doesn't want to call and talk to a person, but you have a direct email where they can get their question addressed in a timely way. And humility and responsiveness, an example could include asking for people's pronouns and then using them without judgment. On the next slide, as you consider the aspects of creating a safe space, you want to make sure that you're connecting with all of your audience. You may think that there are certain folks in your communities that you don't serve, but you probably do. You're more than likely already engaging with folks who may be neurodivergent, have vision impairments or mobility issues. There are people who come to you who are part of the LGBTQ plus community. Not everyone is going to show up with obvious signs of where they need support and safety. So it's important to consider all of who your audience could be. And this can include on the next slide, implementing universal precautions. That's creating processes and communications that make things as accessible as possible. And that can help you make sure that you're eliminating as many barriers as possible for people to connect with your organization, no matter who they are or what they have experienced. So this could look like having lever handles in your buildings that make it easy for people who may have mobility issues to open and close the doors. It can include having clear signage, sometimes including maybe a second language that reflects those that you serve to help people visiting your space to know where to go for what they need. Universal precautions is a way of including everyone before they even show up. So on the next slide, we can talk about ways that we can create a safe space culture in your organization. We will not be able to hit everything during this webinar, but there are three main areas that I do want to highlight today. And as we talk about these areas, it's important to note that creating safe space culture should be done across the organization as much as it can be, not just in an individual program or department. We want people to feel comfortable no matter how, when, or who they interact with. It could be online, it could be at an event, in your office building, or over the phone. Safety and support should be in every interaction. So on the next slide, we're going to first look at procedures and processes, or how you get things done. And so we're looking at written communications, first, whatever you create, whether it's your website, a flyer, a social media post, a mail document, you want to make sure that it reflects the safe space of your organization. And so first up, this includes using plain language. It's language that readers can understand and use to respond positively to what you put out. You want to look at the layout of your information. Is it laid out in a way that makes sense and is easily understood? A lot of times, sometimes we put up these long paragraphs of information, these walls of text, but those can be intimidating for some folks to try to read. And you might be saying good things, but if it's all in this long paragraph, they may not even attempt to read it. So you want to make sure that your information is laid out in a way that's easily understood. Um, you want to make sure that there's equal access to the information. If most of the people that you work with aren't coming into your office, it may not be the best idea to just put up a flyer in the lobby. You want to make sure that you're posting it online or mailing it to their mailbox. Do you provide translation for those who don't have English as their first language? With the documents you create, are you using inclusive language? So these are just some thoughts to keep in mind as you're outputting your written communications. On the next slide, we're going to look at the physical accessibility of your space. I talked about it a little bit earlier when I talked about universal precautions, but you want to make sure that your physical space is accessible as well. So that includes accessible chairs for people to sit in, low counters for wheelchair users or people who may just be very short, so they're not talking to a wall if they come in to your lobby. Steps in the bathroom for younger patrons. As a mother of a small toddler, I appreciate when I see a little step stool for my daughter to step up so I don't have to hold her over the counter and try to get her hands clean after we go to the bathroom. Automatic doors, even the button placement for accessible doors should be considered. Sometimes having that button directly next to the door can make it difficult for someone who may be a wheelchair user or um, a walker user. They have to go up to the door, push the button, and then move back to get in place to go through the door. So even thinking about where that button is placed could be considered as well. And then the next slide, you should also think about the flexibility in your processes, giving options. There's times when someone will request something that falls outside of what you may already have in place as part of your process. And within reason, there should be some flexibility to assist them when they need to get help for the services that you provide. So maybe your forms have to be done online and there's no way that you can get around it, but maybe there's a staff person who can assist someone with the online forms if they're not as internet savvy and they really need the help. Or maybe someone does not have internet access in their home. Is there a way that they can come and use one of your laptops or computers to fill out what needs to be done? If there's a meeting that you have that's in the morning, is there flexibility to provide afternoon and or evening options to make sure that everyone is able to access the information you're sharing? Or if that can't be done, can you record it and send out the notes or the minutes to those that are unable to make those meeting times? So just some thoughts to think about being flexible. On the next slide, thinking about the training of your staff and volunteers. As I mentioned earlier, when staff feel safe, seen, and supported, they can pass that on to the people that they work with and for. And with that as the foundation, it's important to make sure that your staff and your volunteers are trained to embody and mirror that safe culture in the work that they do. So that looks like making sure that they know about trauma-informed practices, how to provide great customer service, what to do if there is need for accommodations or flexibility, the process that you all have if there are challenges or issues that need to be addressed. All of those things are integral into making sure that your staff can provide that safe space for those that they serve and that they work with. In the next slide, we'll be talking about the importance of feedback and providing a way for people to give feedback is also key in creating a safe organization. There should be ways for anyone, staff, volunteers, clients, to give feedback on their experience with your organization. Next slide. Having authentic relationships is helpful in this area. Sometimes just an honest comment, a suggested idea after a meeting, or a referral given in a conversation can help your organization improve. And people who feel like they belong are more likely to share in this way and offer their genuine opinions. You should also have a formal feedback process in place, like comment cards or surveys. And the key to allowing people to give feedback is to make sure they know that their feedback was heard and considered. If you make a change based on feedback, acknowledge that. Say, oh, we heard that you like to have these Team Friday lunches. Moving forward, we're going to be having them once a month instead of once a quarter. If you get suggestions but can't implement them for whatever reason, you should share that as well. It helps to maintain clarity and transparency within your organization. For example, we saw you enjoyed our event and you want it to be free next time. Unfortunately, due to our budget, that's something we can't do, but we will do our best to continue to keep the entry costs low, and we'll be researching other options to fund the event moving forward. If people think that their comments or their feedback is just going into a void, they may feel like your organization is being inauthentic and asking for their input, and they'll stop giving their opinion altogether. So on the next slide, it's always important to take accountability. We are human beings. We make mistakes. To maintain a place where people feel safe, seen, and supported, accountability should be taken when things are missed. So on the next slide, here are some things to think about. No matter what the offense is, if one is committed, we need to acknowledge, apologize, and make amends as appropriate. If it's using wrong language like misgendering someone, we should acknowledge, apologize, and commit to using the correct terms moving forward, and then do that. If we send out incorrect information, we need to acknowledge the mistake and correct it as soon as possible. Make sure there's a plan in place to address any issues. If official actions need to be taken, having a plan of who does what and when will help things go smoother instead of having to scramble in the moment. People appreciate acknowledgement of mistakes when it's coming from a genuine place, and it helps to maintain trust when you're straightforward and instead of trying to cover something up or act like it didn't happen. I go to a gym and they usually show appreciation for people once they hit certain milestones. And there was a woman whose milestone was not acknowledged, and she was upset, and she came to class upset about it. And the teacher, she did an excellent job. I was just joining class, but I heard her apology and she was genuine, and they made their amends. But that was just an example that I saw, like in the moment, she was genuinely apologetic. She made it up to the woman, and the woman was disappointed but appeased, and she kept coming to the gym. So it's important to acknowledge when mistakes happen. So on the next slide, we've covered a lot. So let's recap. We can go to the next one. We've talked about what a safe space is and the need that we all have to feel safe. We've talked about trauma-informed practices and universal precautions. We've seen how feedback and taking accountability come into play when creating safe spaces are concerned. And now we're going to shift over to our panel discussion. On the next slide, we're going to talk to some folks who have some real world experience and knowledge in this topic. We have several guests here who are going to share their expertise on creating and engaging with organizations that make people feel safe, seen, and supported. So I'm going to pass it over to my colleague, Melanie. You could go to the next slide, I believe, and she can introduce herself and go from here.
Thank you so much. Thank you so much, Tiara. That was gave us a lot to think about. I'm Melanie. I work with Tiara at Literacy Works. I'm our program director, and I am a former adult educator. And yeah, I'm super excited to talk to this panel. If our panelists want to uh, turn their cameras on, if you would like, we would love to have you on the screen. Um, and we're going to dive in and talk to some folks on the ground about their experience in creating safe and welcoming spaces. So next slide, Nancy. I'm going to let them all introduce themselves and start with one question. And we'll go across from Tiffany, Manuel, Tiara. Tiara's back. You might notice Tiara's now panelist, and Lori. We're so grateful to have you all talking about your experiences and sharing your expertise with us today. So thank you very much. We're going to talk with the panelists, like I said, and then we'll wrap up the recorded portion of this session, and then we'll turn the recording off and we'll have a chance to kind of hear from you all a little bit and also ask any additional questions to our panelists that you're curious about. Let's see, we got everybody here. Okay. So my question for everyone to start is just if you could introduce yourself, tell us about you, the work you do or the program you're involved with, and why accessibility and creating a welcoming culture is important in your work or in your your values. Why is that something that is top of mind for you and how you do things? So we'll start with Tiffany.
Good morning, everyone. My name is Tiffany Favors. I use she, her pronouns. I am the manager of cultural and community engagement at AgeOptions. AgeOptions is the area agency on aging for suburban Cook County. So we serve all the suburbs in Cook County, everything except for the city of Chicago. We are one of the largest AAAs in the state, providing services to people 60 plus, helping people to stay in community and in their homes as long as they want to, and with the support that they need to stay in their homes to do the best work that they can. When I think about creating spaces and accessibility and sites, I think about the vast population we serve. We have such a large service area at AgeOptions with all of the suburbs. We serve a wide variety of people with different needs, different abilities, different races, different ethnicities, sexualities, etc. And it's important that we are providing services for each person that is culturally relevant, culturally competent, and important to their individual needs. So not seeing older adults as a monolith or that everyone 60 plus has the same level of needs or the same wants, but understanding that there is a wide variety and myriad of needs, of desires, of wants, of what that support looks like, and finding the best ways to provide those services as much as we can in such a large population and in such a diverse way of understanding our clientele and their individual needs. So this is something that we look at every single day in our work in terms of who we're serving, how we're serving them, and how we can continue to provide culturally relevant services to our clients and to the communities that we serve.
Thank you so much, Tiffany. That's such a great through line that I think will keep coming up, this idea that that no community is a monolith and that we have to look at each individual person that we're encountering each day. This is everyday work. Thank you. Manuel, please feel free to share with us a little bit about you and your work and why this is important to you.
Yes, my name is Manuel Gonzalez. I am a community organizer for the Progress Center for Independent Living. We are one of 22 centers for independent living throughout the state of Illinois, and we help. We service our population with the people with disabilities in Cook County, suburban Cook County, so we provide services to help people with disabilities to live independently in their community. We also assist them to get out of the nursing homes into the community. We also provide services and getting them a personal assistant or anything of housing or home modification. We also have a support groups and to help them to get them more introduced to themselves to be independent in the community. So I feel like with this, I feel like we will be get the ability to get ourselves more accessible into the community. Our organization addresses that. We also provide services for also senior citizens with their with benefit access applications and with their Medicare or Medicaid questions. So basically, our organization's morally to provide independency and accessibility, and that's the number one thing that we should do as a community with people with disabilities. We also our organization has the ability because we not only people with disability, we also have employees who are disabled and have a disability. So that's our organization's unique in that sense. So that's all I have to say about my organization.
That's great. Thank you so much. Lots of things for us to think about there. Yeah, of our staff, our colleagues that we
Yeah.
can so make sure feel included and welcome. That's a great point. We'll definitely come back to these ideas. Next, we'll have Tiara, and then we'll follow up with Lori. Tiara, tell us a little bit about how you're a panelist now.
Hello, I'll be brief since I spoke so long earlier, but I do, with Literacy Works, I do facilitate our Community Voices project, and they're a group of community members that help to inform the work that we do at Literacy Works. We have a lot of clients that come to us that are healthcare, government, and a lot of the work that they want us to work on is for the people that are in our Community Voices group. So we have a wide range of individuals across cultures, backgrounds, age groups. We have people with disabilities. We have neurodivergent folks. So their input helps us to make sure that what we are creating that is intended for them is actually written in a way that they understand and are able to access it. They inform a lot of the decisions, and their input is valuable. Things that I would never think of. Based on their experience, they're able to give comments just off the first reading that I would have never thought of, that is helpful and informative and will help others who have similar backgrounds. So we meet once a month, and they help to inform the work that we do, and we do compensate them for their time and their knowledge. And they are a great group. We've established a trust and a rhythm where they do give their genuine opinions. So a lot of times they don't know the clients that we're working with, but they do give very good input and knowledge.
Thanks so much, Tiara. And Lori, please feel free to introduce yourself and tell us a little bit about why accessibility and creating welcoming spaces is important to you.
Hello, everyone. My name is Lori Woodley. I am a community member / former board member of Progress Center for Independent Living. And as I've been listening to the presentations thus far, accessibility is important. But what I thought about was safe, seen, supported. I've been around Progress Center, I think, for about 15 years, possibly longer. And when I stepped through the door for a transportation meeting, I felt safe. I followed someone here. Community organizer invited me to an annual meeting a couple of weeks after that meeting. I was seen, and over the years, I have been given opportunity and been supported and been, can I say, the new term is voluntold. But I want to say I've been offered many volunteer opportunities to kind of find out my place in my space in advocacy, in accessibility and disability matters, or disability matters. But the fact that I'm sitting here on this webinar is a true salute to Progress Center for Independent Living, because if I never felt safe, if I never felt seen, if I never felt supported, when the offer came, I would have said, "Are you kidding? No way, I'm not doing that." So I'm delighted to be here and I have this opportunity. And let's see, I think that's about it. Thank you.
Thank you so much, Lori. I love that voluntold. But I think to your point of giving, making opportunities available to people, and obviously, right, there were things that struck your interest and you were able to be involved in, which is really amazing. Thank you so much. Well, I'm going to bounce around a little, but I'm going to start with Tiffany because we talked about a little bit of some things that came up that I thought were really really cool in our pre-conversation, in terms of just thinking about people as full human beings that have multiple identities. You brought up when we were prepping for this the intersectionality or the multiple identities that people hold in the way your organization tries to meet people where they are and really recognize them as full humans. Do you mind speaking to some of the examples of the ways that you work with older adults to make sure you're meeting their needs, and just share a few examples?
Sure. I think one of the best examples of that in our organization is with our meal program. So we work with a lot of community partners funding meal services that both includes congregate meal sites, so places that older adults can gather, and are served a meal that serves the purpose of both meeting nutritional needs and also meeting socialization needs for people to help dealing with issues around isolation so they can come out and socialize. We also provide services around home delivered meals as well. So making sure people have the food that they need, whether that's the food from Meals on Wheels that's ready to go, or meal kits that people can cook the food and provide for themselves in their own home. But around those programs, we have a lot of, again, culturally relevant work where we partner with other community organizations to provide culturally relevant food. So we're not asking someone to just eat anything, or we're saying, this is the basic American diet. Here are the basic staples that you would eat in a meal. Have at it. This is what we provide. This is what you have to eat. But understanding that some of our populations, some of our immigrant populations, people who maybe came to this country to be closer to their children, in their work that may not be used to this food. This food may not be what they're used to, what they enjoy. It may be nutritional, and it is, but it may not be what they're used to. So they're not particularly interested in it. So we partner with a lot of community organizations to provide culturally relevant meals. So we work with an organization called Hanul that serves the Korean American population, and we serve specific Korean meals so that the older adults are eating food that they know, food that they're used to, and food that makes sense with them. We also work with a lot of Arabic family services, so providing food for our Muslim populations as well. One of the other things that we consider with our Muslim population, of course, during Ramadan, when fasting is happening, to have food delivered at different times so people are able to break their fast and receive the food that they need, but receiving it in a way that they can eat in the evenings or they can eat in the early morning before the sun rises, so they have the food as well. But we work with a lot of populations to ensure that our food programs and our food services provide just food that makes sense to people, because that's what it's going to come down to. Someone who's 80 years old, that this is the food that you've been used to eating your whole life. The idea of saying, well, now you have to eat a different way or you have to eat different foods because this is what we provide, doesn't it doesn't work. It doesn't show our commitment to seeing individuals. We're talking about being seen here. So actually seeing people, seeing their needs, and seeing them as whole humans. Again, that intersectional piece of you're not just an older adult, but this is also your ethnicity. This is also the group that you belong to. And all of these things matter. And we can make an effort to connect with you on all of these various levels to ensure that you are being seen, you're being supported, and ultimately that you're safe.
I love that example, Tiffany. Thank you so much. Even the choices you mentioned at the beginning of like people can come to a group setting if they want to maybe socialize or be around other folks in the community. The different delivery options, the meal kit options, like, and then all of the other culturally competent work that you all are doing. Like, it's really exciting to hear all the different ways that you've all clearly thought about how to make this work very uh, make it work for the community members you work with. That's a really great example. It's just giving me a lot to chew on. Does anyone else have any examples of either ways that services are being tailored or just are flexible? I think that, yeah, that's such a great point, that flexibility of just making sure people know that they have choices and that we're seeing them as full humans in our world. So either in your interactions with your organization or in your work, would anyone else like to jump in and give an example there?
I have an example, but I don't want to take over anybody. But a small thing that we do, I mentioned that we compensate our community voice project members. We give them gift cards. So we offer them the choice. They get to choose whatever gift card that they would like to have in the we do it in the $30 amount, but they can choose whatever place they would like to have that gift card from, and then they can receive it either digitally through email. We can send it through the mail as a physical gift card if they want. So they have that option to choose where they want it to come from and how they want it delivered to them. And then we do offer multiple times. We have a morning, an afternoon, and an evening meeting time. So whatever works best with their schedules, we're able to do that as well. So that's just a small example of how we offer choice.
Thanks, Tiara. Thanks so much for sharing that. Yeah, and the Community Voices group operates in a virtual space, so it's also important since maybe you're not going to be seeing people one-on-one, but there's still that relationship building happening. Thank you for sharing those. Manuel or Lori, is there anything you want to add? Any examples that either you've experienced or been a part of that you've been excited about in terms of just being flexible in how services are delivered, or that you've had experiences of that you've really appreciated?
So the oh, okay. So this is Lori. I as being a part of Progress Center and coming in and feeling good about being in the space, probably one of the most powerful things is connection. There's been over the years an opportunity to just connect. And one of the most powerful ways of connection is to sit down and break bread with people. And so Progress Center has in their main conference area a big table. And for years, we would come together, come for a meeting, and sit down and have lunch. And that's where you connect. That's where you see authenticity. And I think some of that possibly, I know, I know you guys are probably tired of hearing post-pandemic, pre-pandemic, but the effect is still not off yet. We're still, can I say, if I take Okay, you check your post and the doctor says, if you want a good post, you maybe don't want to take it at the wrist with your thumb. You might want to use your index finger, or you might want to go to your neck. So the post, just keep finding out where's the best place to get a post on what has happened post-pandemic and where to go from there. Because what I've noticed is over during the pandemic, I've aged. Since I've been at Progress Center, I've gone from being a middle-aged adult to an official senior. Golly, when did this happen? So there's been some adjusting, and I think the people around me have been adjusting too as they've been aging. And so that means something different with all of this stuff going on to build community and then pull in younger people. So it's very, the process is not static, but it's organic. It's breathing and flowing and all of that stuff. So you got to keep it lively. right? So those are my thoughts on that.
Oh, thank you, Lori. I love that. It's not static, it's organic. Yes. I love that idea of just what I'm hearing is the idea of just like building community is a continuous process. It's not just one and done. It's showing up and being interested in people and really making sure to foster those connections and food. I know I used to work in an adult education program and we'd have a big potluck at the end of every session and it was
Mhm.
always such a joyful day. Just everyone having a good time listening to music, sharing food. So you're sending me back to to some good food memories. Manuel, is there anything you'd like to add about just examples of flexibility or welcoming that you want to highlight?
Uh, I just highlight morally that what progress centers, like what Lori said, that it's just more of having more into being accepted in the disability community, or being more safe, like being safe that you know that you have people who have the same disabilities or on disabilities. So you feel that there's that accessibility or a safe space to talk about issues or talk about what's going on with disability issues and stuff.
Yeah, it sounds like just being able to be yourself and be present and be honest and have other people recognize that. Yeah, that's great. Thank you. These are great. I'm just so energized hearing your examples. Um, does anyone have an example where maybe something didn't go the way you expected, and you kind of learned from that to be able to apply it to the future, or something that you've experienced where you're like, oh, I thought that this would work, but I realized, oh, if we do it this way, more people will be able to be involved. I know it can be hard sometimes to reflect on the things that don't always go 100% perfect, but hopefully, I think I'm still learning this. I think of myself as a former perfectionist because I think it's hard to get away from because we want to do a good job. But is there any types of things where you've learned something along the way that you've taken with you that you see now as like a learning experience and not necessarily something that didn't work, but something you learned from that you'd want to share?
Mm. I think if you want something done, you have to be willing to go in 100%. So I can sit back and say, oh, yeah, I'm concerned that there's not enough housing. I'm concerned about this. I'm concerned about that. But if I'm not willing to kind of press myself into a place to do something about it, even not knowing what that actually means, sometimes to go into something uh, when you're not 100% of what that could mean. And once you get in there and you think, oh my gosh, what am I doing here? Can I go now? But staying in there and kind of roughing it out until you see some resolve uh, of the issue or something like that. But I was thinking about when things just don't quite work out the way you expect them to. And I think one of the examples I've experienced uh, at Progress Center is our annual meeting. We vote, the members, community members vote for the board, and uh, we have information before that actual day. And sometimes I've noticed as a former board member, when the count comes back on how many people voted, I'm always amazed. I'm thinking, what? It was 50 people there and maybe 10 members voted. So my concern has always been, so why aren't more people voting? Is it that it's not in the format? So I don't know. I think probably that is one of the discussions um, that probably for a few years I wanted to have and find out what can we do to get 100% or 50%, right? Because it does matter who the board of directors are, the board members for this organization, especially if we're utilizing and connecting people with the service. So that's one of my areas of concern, what to do to change those numbers.
I love that example, Lori, of just approaching with curiosity of like, what's going on here and how can we like dig into this more? I think too, when you talk about voting, that's like a voting on all levels, right? And
Yeah.
participating in society. So I love that example of just being curious about how we can build more community and more engagement with folks. Thank you for sharing that. Does anyone else have an example of kind of a lesson learned that you'd want to highlight?
Uh, with me as a community organizer, many times you get the community to get them to know as an event or something going on that you advocate, and sometimes you get a little discouraged that you get low numbers of people to advocate on an issue or to attend events. Or there's times I get surprised that people do show up for events and actions or advocate on something. It varies time to time.
Yeah,
That's
that
my
it's yeah, it's
example.
easy to sometimes want to like put it behind you instead of go, oh, let's think about what worked and what people might, want more of or less of or things like that. Yeah, it can be hard to kind of like unpack something afterwards, but so important. Thank you for sharing that. Tiffany or Tiara, anything you want to add about lessons learned? And that's okay if not. um, if you think of something, feel free to chime in. Um, let's see. I have some more questions. What advice, I guess, would you have for an organization that knows they want to do more work in this area, or they're not sure where to start with? Maybe they know that they want people to be more involved or more engaged, but they're not sure where to begin. What advice might you have for someone in an organization to kind of push that momentum forward?
Okay, Lori, will start right quick. One of the things that helps, if you know someone who's probably already involved with the organization, how do you do that? Hey, this is going on here. Why don't you come and join? Sometimes I feel like a walking commercial for the things that interest me. I love Chicago Public Libraries. I'm always telling people, hey, come to the library. This is going on, that's going on. I'm gearing up to invite friends to Progress Senior Center's annual meeting in June. And so I've been thinking about the way to approach that, how it will look different from my friends who are seniors and probably, oh, well, Progress Center, isn't that for young people? And then maybe how to get those people who are still possibly in working, the people who have never been. So all of that's kind of rolling around. Why? Because we're at a critical moment, all over the place in our world, in our nation, et cetera, in our lives. But that's one of the things that I've been contemplating how to share. So if a person is already involved, come follow me. Hey, we're going to have a great time. Now, if a person is not going to new ventures, well, sometimes you just got to go and show up on your own and do things independently and then come, to survey something. So what am I doing as I'm sitting here participating? Hey, you better believe I'm surveying. I'm surveying the panels. I'm doing a blind survey. That's my own joke. But I think that's about it. Yeah.
I love that. And another thread I hear there is like finding the cheerleaders, like finding the folks that are enthusiastic and are the connectors. You sound to me like one of those folks. So yeah, like saying that not everyone like feels comfortable in that role, but the people that do really can be such an asset to an organization. So looking for the champions and then giving them ideas of things that they can help with, because sometimes people may not know what to do, but if you give them the tools or you give them some ideas, they can run with it. So yes, and shout out to Chicago Public Libraries. Thank you for highlighting them. Such great. Third spaces, we need those. Anyone else have advice or suggestions for an organization that feels like they want to do more in this area?
I always advise that people are actively talking and engaging with the communities that they want to serve to ensure that their voices are heard. Really looking from an equity lens or an equity perspective of who's at the table when we're making those decisions, when we're trying to decide where to go with our program, what directions, how we want to meet people. Are the people who are directly impacted a part of that conversation? Are the people who are going to utilize the services a part of the conversation, making decisions, weighing in a meaningful and important way, I think is so important because we can use data and we can use research. And I think there's a time and a place for it and it's useful, but it's also helpful to hear in the moment what a community needs and what people feel like they actively need in that space to ensure that we're meeting their needs, that we're hearing them, that we're showing up for them in a meaningful and an important way. So I think it's important to just always be talking to the communities we serve, to always be engaging, to always be ensuring that the voices, the people are at the table and that we're hearing as much as we can from them.
I do have an
I
example
agree.
too.
Go ahead, Manuel. Go ahead.
You can go first.
No, I was just gonna say I agree. I've been to many an event or been a staff person that have put on events where comments were said like they keep doing this or they gave us nobody asked for this. What we really need is B and they're giving us A. So I agree that making sure that you have the input of those that you're serving is important. And I've been even as a staff person where I've been at places of work where they thought they were doing something nice for the staff, and we were just like, no one asked for this pizza party. We need this instead. Why are we here? So I agree, making sure that you are getting input and making sure the right people are at the table making the decisions is very important.
Again, as a community organizer, it's always great when I go out in the community, especially where I work at. I'm from Pagos Center, but I'm at our satellite office in Blue Island. So I engage with other organizations in the area here in Blue Island, or they call Southland. So it's just basically it's so interesting how organizations are doing and see and to show to engage in those other organizations for resources or to see what they're doing as an organization and the community because we are a big community and we always should not stay inclusive in one community. We always should see other communities and see what they do and how they provide services for people in general. So,
I think that's such a great point too. So many times nonprofits can be pitted against each other for resources, and kind of rising above that and saying, no, we're all in this together. How do we make sure that we're serving our communities best? And if you can do this, I do this, and we can share those resources so that we can get the most benefit. I think that's such a great point of we can do more together than we can apart. Before we wrap up the recorded portion of this session, does anyone have any thoughts you really want to make sure that I didn't ask about that we talk about in terms of welcoming spaces, accessibility, making sure people feel recognized and heard in organizations? Any final thoughts before we turn off the recording and give people a chance to ask questions? Well, I've loved hearing all of these examples today. These have been really inspiring and energizing. Thank you all so much. If you don't mind staying on, we're gonna just wrap up a few business things, and then Tiara will have a question for the folks that are staying on, and then we'll see if folks have any other questions for you off recording, and we'll go from there. So Tiffany, Manuel, Lori, hang tight, and Nancy, can you throw those slides back up, and we'll just share a little bit about other things coming up. Next slide. So we want to make sure that you all know we have a video that will be coming out in a few days about translation and interpretation services and some tips for that. There's also a one-pager if you prefer to check that out. We also have an adaptable tool that is in that resource list already, just to start some conversations about how are we talking about people and places in our work? Are we being consistent? Are we being respectful and talking about people the way they want to be talked about? There's a very short guide that just has some resources and gives some conversation starters to have some of those conversations at your organization. All of these things you can find on that resource list, and they'll also be at on the Health Literacy Hub website that I'll highlight too. And then there's a survey. Of course, we'd always love to get your thoughts, so please feel free to fill that out and tell us what you think and other things you'd like to hear about. Next slide. I also want to highlight, this is part of a webinar series, so you can check out all the past webinars on the healthliteratecookcounty.org, but also we have 2 more coming up. The next one is in July, and that one will be focused on communication practices and standards. We love plain language, so I'm of course excited about this one. So definitely keep an eye out for that if that is something that you'd be interested in joining us for. Next slide, Nancy. Again, this is that resource page. You can find it at bit.ly/OHL webinar 4. It is case sensitive, so you need to have that capital OHL, or there is the QR code. But Darcy also will be sharing out resources after this conversation. Next slide. Oh, those are just some references for some resources, and just some contact info for Tiara and Darcy if you want to connect with any of us. Please feel free to do that. You can also follow CCDPH in all sorts of places, so definitely check those out. I think the next slide might be the last. Oh, yep, the last one. So thank you so much for everyone who's joined us. Please feel free to stay on. I'm going to pass it to Tiara after we turn off the recording, and she's going to ask a question for us to consider. And then if you have more questions for our panelists, hopefully everyone can stick around. So thank you all so much for joining us today, and we'll wrap up this part of the session. Thank you so much.